Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Kidney stones form when certain substances in your urine, such as calcium, oxalate, and uric acid, become highly concentrated and crystallize. There are several factors that contribute to the formation of kidney stones. Dehydration. Dehydration plays a significant role in kidney stone formation because it leads to the concentration of substances in the urine. When you're dehydrated, your body doesn't have enough water to adequately dilute waste products, such as calcium, oxalate, and uric acid, in the urine. As a result, these substances can become more concentrated and form crystals, which can eventually develop into kidney stones. Dehydration can occur due to various factors, including not drinking enough fluids, excessive sweating, such as during intense physical activity or in hot weather, certain medical conditions that increase fluid loss, like diarrhea or vomiting, or inadequate fluid intake due to illness. To prevent dehydration and reduce the risk of kidney stone formation, it's essential to drink an adequate amount of water throughout the day. The recommended daily fluid intake varies depending on factors such as age, sex, weight, and activity level, but a general guideline is to drink at least 8 glasses of water per day, equivalent to about 2 liters. However, individual fluid needs may vary, so it's essential to listen to your body and drink enough water to stay adequately hydrated. Additionally, consuming fluids that promote urine production, such as water, can help flush out the urinary tract and prevent the buildup of crystals that can lead to kidney stones. It's also essential to be mindful of other factors that can increase fluid loss, such as caffeine and alcohol consumption, which can act as diuretics and contribute to dehydration if consumed in excess. Overall, maintaining proper hydration is crucial for preventing kidney stone formation. By drinking enough water and staying hydrated, you can help ensure that urine remains adequately diluted, reducing the risk of crystal formation and the development of kidney stones. Diet. The role of diet in kidney stone formation is complex and multifactorial. Several dietary factors can influence the concentration of minerals in the urine, which can affect the formation of kidney stones. One of the most well-known dietary factors associated with kidney stone formation is the consumption of foods high in oxalate. Oxalate is a naturally occurring compound found in many plant-based foods, including spinach, chocolate, nuts, and certain types of berries. When oxalate combines with calcium in the digestive tract, it can form calcium oxalate crystals, which are the most common type of kidney stone. Therefore, individuals who consume a diet high in oxalate may have an increased risk of developing calcium oxalate kidney stones. In addition to oxalate-rich foods, the intake of sodium, salt, can also influence kidney stone formation. High dietary sodium intake can increase the amount of calcium excreted in the urine, leading to higher levels of calcium in the urine, which can contribute to the formation of calcium-containing kidney stones. Other dietary factors that may affect kidney stone formation include protein intake. High consumption of animal protein, particularly red meat and poultry, may increase the risk of uric acid and calcium oxalate stones. Sugar and fructose. Diets high in sugar and fructose may increase the risk of kidney stones, possibly due to their effects on urinary calcium excretion and the production of uric acid. Fluid intake. Inadequate fluid intake can lead to concentrated urine, making it easier for crystals to form and grow into kidney stones. To reduce the risk of kidney stone formation through diet, individuals can make several dietary modifications, including increasing fluid intake, particularly water, to help dilute urine and prevent the formation of crystals. Consuming a balanced diet rich in fruits, vegetables, and whole grains, which can provide essential nutrients and help maintain urinary pH levels. Limiting the intake of foods high in oxalate, sodium, animal protein, and sugar to reduce the risk of stone formation. Overall, dietary factors play a significant role in kidney stone formation, and making appropriate dietary modifications can help reduce the risk of developing kidney stones. Genetics. While lifestyle factors such as diet and hydration play a significant role in kidney stone formation, genetics also contribute to an individual's susceptibility to developing kidney stones. Family history can be a strong indicator of one's predisposition to kidney stones, as genetic factors can influence the way the body processes and excretes certain substances that contribute to stone formation. Studies have shown that individuals with a family history of kidney stones are at a higher risk of developing stones themselves compared to those without a family history. This increased risk may be due to inherited traits that affect the metabolism of substances like calcium, oxalate, and uric acid, which are major components of kidney stones. Several genetic disorders are associated with an increased risk of kidney stone formation. For example, primary hyperoxaluria is a rare genetic condition characterized by the overproduction of oxalate, leading to the formation of calcium oxalate kidney stones. Other genetic disorders, such as cystinuria and dent disease, can also predispose individuals to specific types of kidney stones. Genetic factors may also influence other aspects of kidney stone formation, such as urinary pH levels and the activity of enzymes involved in mineral metabolism. Therefore, understanding one's family history and genetic predisposition to kidney stones can be important for assessing individual risk and implementing preventive measures. While genetic factors contribute to the risk of kidney stone formation, they do not guarantee that an individual will develop kidney stones. Environmental factors, such as diet, fluid intake, and lifestyle choices, also play a crucial role in stone formation and can interact with genetic predispositions to influence overall risk. Overall, genetics is an important factor to consider when assessing an individual's risk of kidney stones. By understanding one's family history and genetic predisposition, individuals and healthcare providers can take proactive steps to reduce the risk of stone formation through lifestyle modifications and targeted interventions. Medical conditions. Various medical conditions can increase the risk of kidney stone formation by altering urinary chemistry or contributing to the buildup of substances that form stones. Understanding these medical conditions and their effects on kidney stone formation is essential for identifying individuals at higher risk and implementing appropriate preventive measures. Some medical conditions associated with an increased risk of kidney stones include hyperparathyroidism. This condition involves the overactivity of the parathyroid glands, leading to elevated levels of calcium in the blood and urine. Increased urinary calcium excretion can promote the formation of calcium-containing kidney stones. Urinary tract infections, UTIs. UTIs can create an environment conducive to stone formation by altering urinary pH levels and promoting the growth of certain types of bacteria that can produce substances that contribute to stone formation. Metabolic disorders. Certain metabolic disorders, such as cystinuria and primary hyperoxaluria, involve abnormalities in the metabolism of specific substances like cysteine and oxalate, leading to increased urinary excretion of these substances and a higher risk of stone formation. Inflammatory bowel disease, IBD. Conditions like Crohn's disease and ulcerative colitis can increase the risk of kidney stones due to factors such as malabsorption of nutrients, dehydration from diarrhea, and changes in urinary chemistry. Renal tubular acidosis, RTA. RTA is a condition characterized by impaired acid-base regulation in the kidneys, leading to abnormalities in urinary pH levels and an increased risk of certain types of kidney stones. Other medical conditions. Chronic kidney disease, gout, obesity, and certain types of cancer, e.g., lymphoma, are also associated with an increased risk of kidney stones due to various factors such as altered mineral metabolism, dehydration, and urinary tract obstruction. Management of underlying medical conditions is essential for reducing the risk of kidney stone formation. This may involve medications to control symptoms and prevent complications, dietary modifications to reduce stone-forming substances in the urine, and lifestyle changes to promote overall kidney health. In summary, understanding the relationship between medical conditions and kidney stone formation is crucial for identifying individuals at higher risk and implementing targeted interventions to prevent stone formation and associated complications. Obesity. Obesity is a significant risk factor for kidney stone formation, as it can contribute to several physiological changes that promote the development of stones. Understanding the relationship between obesity and kidney stones is essential for implementing preventive measures and managing the risk of stone formation in individuals who are overweight or obese. Several factors associated with obesity may increase the risk of kidney stones, including urinary changes. Obesity can lead to alterations in urinary chemistry, such as higher levels of calcium and uric acid excretion, which can promote the formation of kidney stones. Insulin resistance. Obesity is often associated with insulin resistance and metabolic syndrome, which can lead to abnormal glucose and insulin levels in the blood. Insulin resistance may also affect urinary chemistry and increase the risk of stone formation. Dehydration. Individuals who are overweight or obese may have higher fluid requirements due to increased metabolic demands and greater water loss through sweating. Failure to meet these fluid needs can lead to dehydration and concentrated urine, making it easier for kidney stones to form. Dietary factors. Obesity is often associated with poor dietary habits, such as high intake of sodium, animal protein, and sugar, which can increase the risk of kidney stone formation. Physical inactivity. Sedentary behavior, common among individuals who are overweight or obese, may contribute to the development of kidney stones by promoting urinary stasis and slowing down the passage of urine through the urinary tract. Managing obesity and adopting a healthy lifestyle are essential for reducing the risk of kidney stone formation in overweight and obese individuals. This may involve weight loss. Achieving and maintaining a healthy weight through a balanced diet and regular physical activity can help reduce the risk of kidney stones by improving urinary chemistry and overall kidney function. Dietary modifications. Adopting a diet rich in fruits, vegetables, whole grains, and lean protein sources while limiting the intake of sodium, animal protein, and sugar can help prevent stone formation by reducing the concentration of stone-forming substances in the urine. Hydration. Drinking an adequate amount of water throughout the day is crucial for preventing dehydration and maintaining dilute urine, which can help prevent the formation of kidney stones. Physical activity. Engaging in regular physical activity can help promote urinary flow and prevent urinary stasis, reducing the risk of kidney stone formation. Medical management. In some cases, medications or surgical interventions may be necessary to manage obesity-related complications and reduce the risk of kidney stones. Overall, obesity is a significant risk factor for kidney stone formation, but lifestyle modifications and targeted interventions can help reduce this risk and promote overall kidney health. Medications. Certain medications can increase the risk of kidney stone formation by affecting urinary chemistry, promoting the buildup of stone-forming substances, or interfering with kidney function. Understanding the potential effects of medications on kidney stone formation is essential for identifying individuals at higher risk and implementing preventive measures. Some medications associated with an increased risk of kidney stones include diuretics. Diuretic medications, such as thiazides and loop diuretics, are commonly used to treat conditions like hypertension and edema. However, diuretics can increase urinary calcium excretion and promote the formation of calcium-containing kidney stones. Antacids containing calcium. Antacids that contain calcium carbonate, such as Tums, Rolaids, and Maalox, can increase urinary calcium excretion and contribute to the formation of calcium-containing kidney stones. Antibiotics. Certain antibiotics, such as sulfonamides and ciprofloxacin, can increase the risk of kidney stones by promoting the crystallization of certain substances in the urine or altering urinary pH levels. Protease inhibitors. Protease inhibitors, used in the treatment of HIV/AIDS, can increase the risk of kidney stones by promoting the formation of crystals in the urine. Other medications. Several other medications, including antiretrovirals, anticonvulsants, and immunosuppressants, have been associated with an increased risk of kidney stones due to various mechanisms, such as alterations in urinary chemistry or kidney function. It's essential for healthcare providers to consider the potential effects of medications on kidney stone formation when prescribing medications to patients, particularly those with a history of kidney stones or other risk factors. In some cases, alternative medications or dosage adjustments may be necessary to minimize the risk of stone formation. Individuals taking medications associated with an increased risk of kidney stones should be monitored closely for signs and symptoms of stone formation, such as flank pain, blood in the urine, and urinary tract infections. They should also be advised to maintain adequate hydration and follow a healthy diet to reduce the risk of stone formation. In summary, certain medications can increase the risk of kidney stone formation by affecting urinary chemistry or kidney function. Healthcare providers should be aware of these potential risks and take appropriate precautions when prescribing medications to patients. Overall summary: kidney stone formation is a complex process influenced by various factors, including dehydration, diet, genetics, medical conditions, obesity, and medications. Understanding the interplay between these factors is essential for assessing individual risk and implementing preventive measures to reduce the risk of kidney stone formation. Dehydration can lead to concentrated urine, making it easier for crystals to form and grow into kidney stones. Adequate fluid intake is crucial for maintaining dilute urine and preventing stone formation. Diet plays a significant role in kidney stone formation, with certain foods high in oxalate, sodium, animal protein, and sugar increasing the risk of stone formation. Making dietary modifications, such as increasing fluid intake and reducing the consumption of stone-forming foods, can help reduce the risk of kidney stones. Genetics also contribute to an individual's susceptibility to kidney stones, with family history and genetic predispositions influencing urinary chemistry and mineral metabolism. Medical conditions such as hyperparathyroidism, urinary tract infections, and metabolic disorders can increase the risk of kidney stone formation by altering urinary chemistry or promoting the buildup of stone-forming substances. Obesity is a significant risk factor for kidney stone formation, with factors such as urinary changes, insulin resistance, dehydration, poor dietary habits, and physical inactivity contributing to stone formation in overweight and obese individuals. Certain medications, including diuretics, antacids containing calcium, antibiotics, and protease inhibitors, can increase the risk of kidney stone formation by affecting urinary chemistry or kidney function. Healthcare providers should be aware of these potential risks and take appropriate precautions when prescribing medications to patients. Overall, a comprehensive approach that addresses lifestyle factors, underlying medical conditions, and medication use is essential for reducing the risk of kidney stone formation and promoting overall kidney health. By understanding the factors that contribute to kidney stone formation and implementing preventive measures, individuals can reduce their risk of developing kidney stones and minimize the associated complications.